question is who gets these cancers and what are the types of symptoms to look out for? And this is a little bit of a challenging aspect because the head and neck is an area of the body with very finely tuned nerves and muscles. And so the type of symptoms of head and neck squamous cell carcinoma are often somewhat nonspecific. And so it's not to worry someone, but there are things like ear pain, sore throat, a persistent sore or ulcer in the mouth, bad breath, or for instance, a lump in the neck. Again, these are things that sometimes we think are somewhat subtle. And in my experience, when a symptom is associated with head and neck cancer, it is persistent. That means greater than 3 to 4 weeks. It's relatively constant. It doesn't just come on suddenly and generally go away. So if you have a sore throat for a few days, that's probably much more likely to be an upper respiratory infection and not related to cancers. So it's not to worry anybody when they have a bit of ear pain. These are symptoms that go on for several weeks, often are progressive, particularly a lump in the neck for more than a month. And oftentimes these lead to a visit to the primary care doctor, perhaps a bit of antibiotics if there's felt to be an infectious origin. But those are the types of symptoms we see. Difficulty swallowing, again, that's persistent. Voice changes, hoarseness. Again, not a little nonspecific hoarseness that can come with acid reflux that tends to get better in a day or with some reflux medication, but persistent type symptoms, tumors that can occur in the sinus cavity. And so we talk about fullness and pressure, stuffiness, perhaps bleeding from the nose. Generally, the symptoms associated with cancers are not subtle, and they're not mild, and they're not quickly coming and going. They're persistent for a long period of time. But they can include numbness, facial pain. The vast majority of these symptoms are not cancer, but if they do go on for a long period of time, then they would lead to a visit to a physician. And if that physician is sufficiently concerned, a referral to generally an otolaryngologist or ear, nose, and throat doctor.